Good morning, guys. I hope we're all sparkly. It's a beautiful day. I'm here in clinic. Lydia, she's on the beach. How rude. We're going to go through a couple of case studies just to highlight the importance of personalised medicine and the need for follow-up, active follow-up, and support from your prescribing clinician. So, these guys essentially started their TRT journeys at the same time, and they're both mid-30s, both presented with more of a secondary picture than a primary picture, so a problem with the brain versus the testicles. Haven't been able to address causation, but both of these guys essentially have a functional hypogonadism. Started them both off on the same protocol. Microdosing testosterone and HCG. The premise behind this is mimicking natural physiology. So we've had their 4-week bloods. Let's go through number 1. Total testosterone at 4 weeks with levels measured in a trough. 86.2 nanomole per litre. 86.2. Free T 3.22. Estrogen 354. SHBG 16.3. So this guy at 4 weeks is massively supraphysiological. How does he feel? Because the bros would be like going, fucking come on. He feels rubbish. He actually hasn't felt any noticeable or tangible difference in his sense of well-being, and if anything, he actually feels quite tired. This goes against traditional thinking of high testosterone. You should feel amazing. Actually, a lot of guys who have high testosterone feel quite lethargic. So what are we going to do with him? Well, funnily enough, we're going to reduce his dose. We're going to maintain the same dose of HCG, but reduce his dose of testosterone cypionate. He's already on daily injections, so we can't alter his injection frequency, nor would we want to, because dailies is best. And we can't change his route of administration because, again, he's on subcutaneous injections because that is superior to intramuscular injections because it reduces the propensity to aromatization. So I've amended his dose and we will review him again in 5 weeks' time and see how he is. Guy number 2, again, mid-30s, same protocol. His testosterone levels have come back at 4 weeks. Total T 27.8 nanomole per litre. Free T 0.885, so perfect. Estrogen 178 and SHBG again low at 11.2. So on paper, those numbers are pretty damn spot on. You could argue that the estrogen's a little bit high, and obviously the SHBG is still quite low at 11.2. Now what we find with daily injections is SHBG seems to find a natural level because, again, the premise behind TRT is mimicking natural physiology. So why do we use HCG? We use HCG to maintain function because testosterone monotherapy suppresses LH and FSH. So HCG mimics luteinizing hormone, hence maintaining testicular function. So with him, well, I need to see how he is first because he's got his 4-week call tomorrow. And we'll make a decision on what we do with him. But I would anticipate But what we'll probably do is advise him to continue weight management, probably supplement with some zinc, and see how he is. And I'll make that decision with him. So why is there such a change? So we're comparing a total testosterone of 86.2 with a total testosterone of 27.8. Both guys share a number of similarities and they have vastly different total testosterone levels. Compliance is good. So what's going on? Well, I'll tell you what's going on. Chap number one with a total testosterone of 86.2 has super functioning testicles. So yeah, he's actually seeing a lot of testosterone production within the testicle from his HCG. Guy number two, not quite so much. But actually, guy number two is actually having a very normal level of intratesticular production of testosterone. So I would anticipate these numbers on that protocol. So it's almost spot on, to be fair. But guy number one, massively high testosterone levels because the HCG is causing a healthy amount of testosterone production within the testicles. Now we see this actually quite a bit, especially in the younger guys. In the younger guys who are in their 20s, who have obviously a secondary problem. So the secondary issue means that they're not sending enough LH down to the testicles. So hopefully testicular function is preserved, and obviously in this guy, it is preserved. And we also know that because his wife has just given birth. So congratulations. So it's interesting, isn't it? Vastly different testosterone levels despite the same protocol, and these guys sharing numerous similarities in age, physique, etc. And they both had low SHBGs, blah, blah, blah. And no identifiable cause, so a functional hypogonadism. So the moral of the story is, what's the moral of the story? Who knows? There are lots of morals. Yeah, personalised medicine, the need for active follow-up. It's all about how you feel. It's all about how you feel alongside other physiological parameters. We need to make sure that we prescribe TRT safely and effectively. Going by how you feel is sometimes a fool's errand, because the first guy who has a testosterone of 86.2 has not noticed a tangible difference. If anything, he's noticed lethargy. So what would you do as a bro? You'd bang up the dose, wouldn't you? Because the premise behind TRT is just normalizing your symptoms, and it's all about how you feel. So if you don't feel good, up your dose. Well, this guy doesn't feel good, so the bros would increase his dose. And what would happen to that? I mean, my God, 86.2. So don't listen to the bros, listen to the doc.